Guys, so today I've got Param from Tailoring Chiropractic and Sports Clinic, and myself from OsteoWest. You guys know me as Jeremy. So Jeremy, and this is Param. So today we're going to go through basically the main differences between a chiropractor and osteopath. There's a lot of confusion on who you should see or what you should see, or who's better or who's worse. And we're here to just clarify a few things and also examine what we can help with as well. So Param can go through the differences or similarities, or what a chiropractor might help and benefit from.
Yeah, absolutely. There is an old saying, I suppose, that when you see four chiropractors, you get four different approaches and four different opinions, and I'm sure it's probably very similar with osteos as well. There's one thing with chiropractic is that there's a vast array of techniques and styles and approaches and philosophies, and a lot of chiropractors are very different in their approaches and what they aim to achieve. In terms of myself, very musculoskeletal based, very much straightforward. I've got my soft tissue massage degrees as well, so I really like to integrate a lot of that stuff into the treatments and the approaches. I find it works quite well. So, from my perspective as a chiropractor, the first thing we always want to look at is look at symmetry, look at function, where the problem is occurring from. And obviously focus on the bigger picture. So it's not just about where the symptom is, it's about where the symptom may be compensating or arising from. So it's about looking bigger picture and then just narrowing it down and tailoring your approach into what we do. Yeah, so I'm sure we can delve into that. We could probably talk for days on that, man, really.
Definitely. And that's the thing. Yeah. I think a lot of people have that big misconception that chiropractors will just look at the spine as well.
Yeah.
And
that is a misconception. Yeah. We look at a lot more, and there's so many approaches that we use in terms of our treatment. So, soft tissue being one, there's, low force adjustments, there's an activator tool, which we'll talk about as well. There's things like dry needling, cupping, all these sorts of, extra modalities that we can integrate into our treatment. So it isn't all just about manual manipulation and adjusting and cracking, as people may refer to it as. There's so much more that we can do than just that. And obviously our focus is the bigger picture. So it really is about what suits the patient, not so much about what just suits what we do. We have to really tailor and organize our treatment approach to suit that person.
Yeah, and that's the biggest thing. That's the same for us as a practitioner. With us, we always tailor it to each patient, exactly like what you said. I think definitely in Australia, we probably have a better evidence based, and we're more direct to tailoring the treatment with evidence to back it up as well, to make it efficient and also ethical for each person as well. Because probably people think they always just want to see me, they just want me to come back every single day of the week. But that's the wrong thing as well, and that's unfortunately some people have had bad experiences, and probably good to know that that's not what we're here to do. It's more we're trying to empower you, give you the factors that might be contributing, whether it be your job, work, or find different avenues. Like you said, you can do dry needling, the cupping, using different activities or modifying activities. And that's where, when you look at the bigger picture, is to focus on, what is contributing to their problem. Is it their sitting arrangement? Is it because they're lifting 20 kilograms and not bending their knees, and, silly things that people know, but they still do, but need someone to give them that advice to obviously rectify as well. Like pretty much what you said is pretty much our approach as well. Like the osteos, we look at the body as a unit. So if there's a problem somewhere else, like you said, we'll sort it out. And I think this day and age, particularly in Australia as well, we all kind of follow that direction, being obviously regulated, and we studied for quite a long time. I believe your degree was 5 degrees as well, 5 years as well for the degree.
5 years. Yeah.
and that's the same with osteos. And I think that's the quality of care that you get in Australia is obviously going to be pretty good, a standard of healthcare as well.
Yep. Very important to integrate with other health professionals. It's not about a chiro or an osteo can fix everything. It's about seeing what our specialty is and how that integrates into the patient's life and into their symptoms, and then how we can fit ourselves into a health model that is overall have the goal to get the best result for the patient, whether it's through their GP or surgeon or podiatrist or nutritionist and all these sorts of things. It's about the bigger picture.
And that's the best approach. And we always get asked, should I go to? Chiro, an osteo or physio or a myo?
Yeah.
And that's exactly what you said. I think the best way is to try them all, or even just have them all for different things and find out what works for you. Because at the end of the day, it's whoever gets you the results you're gonna stick with. So
definitely,
yeah, that's the main important part of it is, and like you said, being able to connect and also fix their problems, no matter what it is, like how little or big it is, at least give them a solution of why it might be happening, or an explanation, or staying within your scope of practice as well. Because there is a time and place definitely for, you might need surgery, you might need, you need something else rather than just manual therapy. And that's probably our job to do, and not just, crack things all the time, which people think, even osteos do that all the time because of the term osteo. But, we look at the tissues, like you said, the ligaments, the structures, the body muscular system, cardiovascular system, respiratory system, and how they all interrelate. And that will be similar concepts with chiropractic as well. And I think the main thing is education. I think people know not to do things, but sometimes they just need someone to really hone in onto that. And what's the common thing you find in your clinic?
Common things.
Common problems.
Look, some of the most common things I see is posture-related problems, just a lot of sitting. Given the demographic of where I'm in Tarnita, so I suppose I get a lot of people who are truck drivers, sitting for, again, long periods of time, getting in and out of trucks, lifting things. A lot of labour people as well, working in the industrial estates nearby as well. So it is a very labour-intensive or prolonged posture style of demographic that I see. So a lot of it is repetitive. A lot of it is an imbalance. You got that proximal cross style pattern that you see where everything is just flexed forward, and you just don't see enough of that extension and balance that occurs. So they're common things, and a lot of it is soft tissue. Like, there's one thing about, tight muscles, but it's also about weaknesses, addressing imbalances. That's the biggest thing, is probably people don't understand that, is that it's not just about you got tight muscle, you got to stretch it all the time. It's not, I think that's the biggest misconception, is that people think that stretching fixes everything.
That's right. You definitely strengthen and condition things and take away eliminating factors. And unfortunately, technology, we have our phones and we're always flexed over as well. So, like you said, doing the rehab and giving the exercises and sticking to the advice will obviously give them long-term relief.
Yeah, that's the biggest thing, the advice, we could talk for days on that one as well. But I think that comes down to education, is that people don't realize as well that just by seeing yourself or me, chiro, physio, osteo, any of these professions, that you can't just expect a change from the practitioner. Essentially that becomes, doctor dependent care. Is that if you're out there doing the same routine lifting 15, 20 kilo boxes repetitively, that you just come in for a session and you expect, the doc to fix it, and you don't do anything in your own time. That's again another misconception, is that, people expect that one session will come in and you'll fix it, but you're going to go out and do the same thing that actually caused the pain in the first place.
Yeah.
So yeah, it's just really about getting people to just sort of think and just sort of realize that what's actually causing it, what do you got to do to fix it, and how can you manage it.
Yeah.
And
It's
obviously
amazing
the
how, yeah, just simple advice like that can make a huge difference for them, particularly if they have headaches or they can't sleep. And that's where we can come in and obviously look at what might be impacting them, whether it be their beds or their pillows or
yeah,
obviously the way they're lifting things and adjusting that as well. So,
yeah,
yeah, honing on that, like you said, at least you can find out a way to just give them some relief. We won't fix them straight away, but long term, it
yeah,
will be a better
yeah,
outcome.
yeah, definitely. Yeah, it's about building a plan,
Yeah,
having a plan with the patient, and you
and,
know how
and
we can.
yeah, and it's interesting because I saw a stat recently. It was saying 25% of Aussies wait until their pain is chronic before they see someone without it, which is insane. And that's
Yeah,
usually what I see as well. They leave it to the last minute. Um, so, I think it's important. If you know something's wrong, which most people do, and I like to use like the car analogy, most people know there's something wrong with their car, but they will leave it till it dies. And you
yeah,
can't do that with your body. So you need to look
no,
after it. You can't just buy a new
real
car. You can buy a new car, but you can't buy a new body. So
no, that's
um,
yeah,
get on top of it early, and yeah, whether it be with chiropractic care or osteo or physio or myo, any type of manual therapy. It's important to obviously find what works well for you, and or use a combination of them that will give you,
yeah,
overall health and well-being as well.
yeah,
And you look after a range of different clients too, don't you?
yeah,
From Yeah. And you accept
pretty
care
much.
plans and stuff, your workplace?
Yeah, so GP care plans, we accept those as well. Each chiro will be sort of different. Some clinics will do, TAC work cover as well. It's really dependent on each clinic, what they decide they want to do. But those sort of options are there for a lot of people as well.
Yeah, no, great. And how long do your consults go for?
So what I do, a new patient consult for me is 40 minutes. In that consult, we'll do a thorough history examination, and then if warranted, we'll also do the treatment as well, and actually get somewhere with the patient, just so they can experience sort of what they could potentially expect. Um, what we'll do after that, a standard visit after that, or a follow-up consult is 20 minutes. So again, it's just about addressing how they pulled up from their first session, what sort of symptoms did they experience, or were there any changes? And based on that, you then start to sort of tailor and build a plan based on how they're responding. Yeah, so a 40-minute and a 20-minute. I also do a 40-minute chiro massage. As I said earlier, I got my soft tissue massage degree, so it's kind of like this fusion treatment that I really work well for me. I love soft tissue, I love chiropractic, and then just sort of merging them together. I've been able to really see a lot of positive differences in my clinic. So
No,
that's good.
yeah, I definitely agree with, using combination of things as well. And
Yeah, yeah, absolutely, man.
I think most of us have become probably manual therapists or, osteo or chiro, usually with their own experiences with their own injuries as well. And whatever works for you at the end of the day, it will help obviously give you results. Osteo ones are very similar. Our ones go for 45, and then we do a
Yep,
subsequent as a 30 minutes. And
yep,
obviously looking at that anatomical approach, looking at addressing other things that might look like they're not causing any issues. But
yep,
obviously, like a good example is maybe hip pain. They might think it's just the hip, but it could be their lumbar spine or in through their back of their legs or their knees. And
yep,
that's where we can obviously address that as well. And you would do a similar thing with orthopedic screening
yep,
and
yep.
testing as well. And obviously, if for whatever reason, if treatment's not viable, we'll send you off, and that's the same thing I would assume with you as well.
Yeah,
Um,
very
and
so, man.
with
Yeah,
our treatment, we use a combination. We do soft tissue work, stretching. At our clinic, we got the shockwave machine. I don't know if you're
yep,
familiar with that as well, which we can use for more chronic conditions and
yep,
tendonitis, or
yep,
plantar fasciitis, the most common one we see.
Yeah.
And yeah, the electrotherapy as well. Um, we just, yeah, depending on the patient, we don't use them for every single person. And that's the
Yeah.
thing, like you said, it's always about tailoring to what works for them and what can help them. And if they don't like needles, obviously we don't needle them as well. So that's just,
Yes.
one option, other option that they have with us as well.
Yeah.
Um,
No, of course. Yeah.
yeah, it sounds, a lot of it sounds familiar, like very similar, but it's obviously different approaches, and,
Yeah.
and the main aim is we're here to help you,
Yeah.
whichever way we can. So, um,
Yeah.
and that's what you'll probably see a lot on the internet. You just write it, and it doesn't really give you a clear cut answer either, as well.
Yeah.
Um, and that's the most difficult thing is, there is not one that's better. It's just you just do whatever works for you, whether it
Yeah.
be both or yeah,
Yeah.
other allied health as well.
Yeah, and even within that, it's about finding the right osteo for you or the right chiro for you. As I
Yeah,
said, there's
yeah,
various different styles of treatments, and if one doesn't suit you, it doesn't mean that we're all like that. I
yeah,
think that's another misconception, is that it's if you hear a bad story, they're all bad, and that's not the case at all with chiro and osteo. It's just about finding the right person that suits what you're looking for. And if you keep looking around, you'll find them.
yeah.
We're
That's it.
out there. We're not all the same. We're not all the same.
Yeah. Well, we like to say, obviously, Tarnita and ourselves at Osteo West. So if you're gonna
Yeah,
pick, will be us. But yeah, I think it's important, like you said, to work as a network, whether with your GP, with your chiro, with your osteo, just working in conjunction together. Obviously, that's going to be a better outcome for the patient, rather
yeah,
than just a sole intervention. Um,
yeah,
and I think a lot of our philosophy is, natural, non-invasive, drug-free way of physical health and well-being. So, um, which is important. Unfortunately, some people are dependent on medication,
yep,
and obviously that long-term is not beneficial for internal organs but also mental and psychological states as well.
yeah.
But there's a time and place for them, and definitely to help with chronic pain, it can help too. Do you see many chronic pain patients?
I do. Yeah. There's a combination of acute patients, chronic pain patients, patients who just want a quick fix as well. That's quite common. But yeah, so it really is. It comes down to, with chronic patients, what's actually potentially causing that chronicity. Is it their behaviour? Is it their workplace? A lot of chronicity is neurological as well. So looking into the neurology of changing what their body expects pain, looking at things like, the sensitization approaches,
Mhm.
and how, the brain structure starts to change when there's pain for such long periods of time. And so it's really just about working with the patient, explaining to them and educating them, because they don't know a lot of this stuff. They don't understand that, why am I constantly in pain? It's
Mhm.
not just about their workplace. It's actually about how their brain structure has changed, the adaptation, neuroplasticity that occurs over time with pain in musculoskeletal health. So just trying to break it down, layer by layer, and trying to get them to understand. I think that's the first step, is getting the patient to understand,
Yeah.
and then you can get something somewhere with that.
No, that's truly important, and I think people understanding why they're feeling pain, um, and then that way they can limit their irritating factors, like you said.
Yeah,
Uh,
yeah,
it's so simple, but people still get it wrong. So, um,
yeah. You can't blame them, because it's just an education thing. A lot of the time it's just a lack of education, and if they find the right person to provide that, it makes a huge difference, like you said before.
yeah, no, definitely. Is there anything else you want to touch base on?
Well, I think one thing, I suppose, a lot of people don't realize we do as well, is the rehabilitation process.
Yep.
It's not just the soft tissue, or the adjustments, or the dry needling, the cupping. It's that, the rehab. If there's an injury, we can actually help. We can tailor programs for rehab exercises. We can monitor and guide and give you functional things that you can work on in your own time. So there's so much overlap. It's the chiro, osteo, physio, there's just so much integration that we all have and overlap in each other. But again, it's a part of building that network. So I mean, if someone is like post-operation, maybe they're best to see a physio because it's just dedicated rehab, but maybe with chronic pain and there's other things that are integrated. So yeah, rehab's another one that we do.
Yeah, no, definitely.
Yeah.
Yeah, I'm highly, I like doing the rehab, obviously, because that's, like you said, it's going to be long term. It's not just because, you can't just keep stretching. Stretching is not going to give you long term relief. About strengthening, finding imbalances, weaknesses, and addressing them. And the only way to do that long term is to exercise and do rehab.
Yeah.
And they're always honing on this with the kids, like particularly young athletes. They just go home, they don't stretch, they don't do the strengthening exercises, they don't do all the stuff that the professionals do. So they wouldn't be doing that if it didn't work.
Yeah.
So
Well, you and I are guilty of that, man, in our junior
so
basketball days.
exactly, we've had the fair share of it.
Yeah. Wish
But,
there was someone that taught us as well, but
yeah. No, that's important. I think people, like yourself and me, we have a high interest in obviously the rehab aspect of it, and obviously that can be part of our difference between a normal chiropractor or a not normal osteopath as well, is having that ability to be able to provide that rehab.
Yep, absolutely. And it comes down to like, I suppose, the practitioner, what their personal interests are. You and I are both athletes. We've played basketball at a decent level before.
Mm-hmm.
So we naturally levitate towards wanting to help athletes out as well. Or when athletes come in, we understand them a lot better because we've been there.
Yep, that's so true.
Yeah, been there. And I've seen all your videos, doing vertical jump stuff, and like, this is all things that we've all done and applied, and we realized it works, and we can then, obviously apply it with patients as well.